According to Montreal police, paramedics asked for their help Saturday morning near the corner of Saint Laurent and Ontario for 2 people having a heart attack. Both victims were eventually pronounced dead in hospital. Police are not commenting on the cause of death, but outreach worker Peer Parent knew one of the victims well.
What we are hearing, though, is that her and the person that she was with, or the 2 people that passed away, died by overdose.
Parent says both victims were Indigenous, and for him as an Indigenous person, the news is devastating.
We've lost far, far, far too many people in the last year of our community member itself. And when I speak of our community, I speak of Montreal's Indigenous, mostly homeless community.
In June, a vigil was held at Cabot Square for 36 Resilience Montreal clients, Indigenous and non-Indigenous, who had died on the streets since 2022.
Well, here we are again, and in the next week or so, we'll be doing another group memorial, okay? And this time, it'll be probably for around, 6+ people. That's just since June.
He says just a week ago at the same square, there was another overdose. Luckily, it wasn't fatal. Someone administered naloxone. Advocates stress that the opioid crisis is affecting the housed as well as the unhoused, but that those living on the street are particularly vulnerable, and Indigenous individuals are especially at risk. Workers have seen an uptick in overdose numbers since the pandemic lockdowns.
Drug dealers were made readily available.
The high number of overdoses raises questions about the need for things like supervised consumption sites. Advocates admit that it can be difficult for some neighborhoods when resources for the homeless move in.
And yet at the same time, if you don't have emergency resources for the unhoused in more or less every neighborhood, then you have a significant increase in overdose deaths.
To help solve the problem, he stresses that a balance must be found. Phil Carpenter, Global News, Montreal.